What to expect from an orthopedic surgeon's OPD? This is today's topic. This is most relevant to the present scenario where you go to a number of doctors and see what happens to you. So myself, Dr. Nagarjuna, I'm a senior orthopedic surgeon from KIMS Hospital, Gachibowli. So my orthopedic consultations begins with a three-step process basically. One is registration. The second one is the opinion or the consultation with the patient, where I see them, I evaluate the patient, and third is the investigations and the treatment part. So first is the registration. We'll get the basic details of the patient, name, age, place and all. So the preliminary idea of where you come from, what do you do, and then the patient steps in. So that's where my evaluation starts. I do examine my patients, how they walk into my OPD, whether they come by walk, they come by wheelchair, they come by a walking stick or some supporting aid, and do they have any supports, splints or any bags with them. So that gives me a rough idea of what is happening with the patient, where do they have the exact problem, and that gives me a clue where I have to start with. So the next part is history taking, where I talk to the patient and I ask them out what's happening with them, what's the actual problem, from when, where, how it all started, so that I land up in a rough idea of where the problem is. And the second part is investigations, or the evaluation part that goes forward. So I do evaluate the patient, examine them either by sitting or in a lying down position and see where the problem is. We have a set of protocols where we have to examine the patient. For each joint it is specific. For shoulder we have some, for the knee we have some, for the hip we have some. We tabulate the positive findings and we end up at a preliminary working diagnosis. So from there, we go for the investigations part. So we do an X-ray, MRI, CT, whatever the patient needs. It's all the doctor who has to decide which investigation has to be done. Sometimes we do get random patients with random reports, unneeded also. So we do comply with them, but still it is the doctor who decides what investigation you need. Sometimes you may get away with a small X-ray, sometimes we need a bigger scan. So that's where my diagnosis starts and my treatment starts.